Each year in the U.S., millions of people are hospitalized for a variety of reasons. Some are admitted through the ER, others admitted by their physician for surgery or some other form of medical treatment. But did you know that most people who end up in the hospital with a serious chronic illness will most likely require something called palliative care?
Palliative care is medical care focused on the relief of pain and other symptoms and support for the best possible quality of life for patients living with serious illness and for their families. And palliative care is delivered at the same time as all other medical care focused on prolonging life or curing disease.
The goal of palliative care is to relieve the pain, symptoms, and stress of serious illness, whatever the diagnosis or prognosis. It is appropriate for people of any age and at any point in an illness. It can be delivered along with treatments that are meant to cure you. Palliative care is typically provided by a team that includes palliative care doctors, nurses, and social workers. The team works in partnership with your primary doctor.
Palliative care is a rapidly growing specialty. Fortunately, most larger hospitals within the United States offer a palliative care program. So patients who have a serious illness, who are having difficulty with symptoms such as pain, nausea, vomiting, can ask their doctor for a referral.
Palliative care is not a one-size-fits-all approach. The key benefit of palliative care is that it customizes treatment to meet the needs of each individual person.
I think that palliative care is right for a very broad range of patients. So it can be patients with diagnoses such as cancer, but certainly patients with any form of heart disease, lung disease, dementia, Parkinson's disease, any condition that has pain or any other symptom that folks will need help with along the way.
Patients who are receiving palliative care report reduced pain and other distressing symptoms, and when they receive this care at the same time as their curative and life-prolonging treatments, they are better able to handle the course of treatment that their doctor has recommended for them.
My recent personal experience with palliative care was when I was in the hospital for a benign brain tumor, and it really made me realize as a physician how important palliative care is, that despite the fact that I was being treated by world-class surgeons, that I really needed somebody who was specifically looking out for my other symptoms, my pain management, the nausea that I had post-operatively, people who weren't necessarily just interested in the incision that I had and whether the surgery was a success, but really were looking at me as a whole individual, and people who could advocate for me in getting adequate pain management and other symptom management. That really is not the forte of surgeons, even when they are world-class.
To learn more about palliative care, visit getpalliativecare.org.